Today on Holistically Well, I am joined by Haley, and she runs the Truth and Fertility podcast. And I am so excited to sit down with her today to talk about her mission for teaching women that the pill is truly a band-aid for our fertility issues. And if you are struggling with acne, irregular cycles, PMS, or painful periods, without ever being taught what your cycle actually means, this conversation is for you. Today, we are all about education and not instilling fear. And we both come at this from a very faith-based lens. And so I think that will also add to today's conversation. Haley, thank you for joining us. And I'd love if you could share a little bit about yourself before we dive in.
Absolutely. Well, thank you so much for having me. I'm Haley. I'm in Arizona. I'm a wife and a mom to three. And I can kind of go into my story a little bit of how I even got here to this place. When I was 16 years old, that's kind of where my story begins. I was put on the birth control pill, and I always had irregular cycles, and that was what was given. That was what was offered, and I didn't know anything different. And so that's what I did. But it gave me horrible mood swings. And so I was only on it for like 2 months. And then I just decided, you know what, having irregular cycles is way better than dealing with what I'm dealing with on this pill. So I decided to discontinue and just kind of lived with the irregular cycles for however long. And then when I was 18, I was really involved at my parish youth group at that time. And there was a talk given by a woman who was just a volunteer in the youth group. And she talked about the church's teaching on natural family planning. But then she also mentioned how you can chart your cycle for like diagnostic purposes, like it can be used in medicine. And I just remember hearing this and I was like it just, something came out of me and I'm like, I need to talk to this woman. So I kind of ran her over right after youth group that night. And I just picked her brain for a long time. And in Arizona, we're very lucky to have an amazing pro-life clinic that practices what we call restorative reproductive medicine. So basically looking at your cycle as kind of like a fifth vital sign, like looking at it as something that is going to actually point to something being wrong or something, some issue being there, and taking that information and actually treating it from the ground up rather than placing a Band-Aid over it. But the kind of funny thing, though, was that I remember going home that night and I told my mom all about this place and I wanted to go to this new OBGYN that I heard about. And she was very prudent, though. And she was like, okay, Haley, that's fine. You can do that. But let's go take a look let's go ask your current doctor if she has any other options for you. Because I can't remember if she was the one that originally put me on the pill or if it was a different doctor at the time. But anyways, I was seeing like a regular mainstream doctor. And so I'm like, okay, I'll do that. So I went back to my regular doctor first and I said, hey, I still am having these irregular periods, but I don't want the pill anymore. What else can you offer me? And she was super kind about it. And she was like, can I ask you why you don't want the pill? And I think just because of that talk that I heard in youth group, this is the extent of what I knew, is that I wasn't ovulating regularly, because if you don't have a regular cycle, you're probably not regularly ovulating. And I knew that the pill wouldn't help me do that because the first mechanism of the pill is to suppress ovulation. And so that's what I said. I'm like, I need to ovulate. Like that's what my body is meant to do. And I'm not doing that regularly. And she looked at me and she said, oh, well, why do you want to ovulate? And it was a moment where I realized there are different opinions in the world of medicine when it comes to women's health. And I'm 18, right? I'm very new to this whole world. I had no idea what I was entering into, but it just made me realize, okay, this doctor is looking at an 18-year-old patient and she's not sexually active. She's not married. She's not trying to have babies. Why does she need to ovulate? But what I know now is that ovulation is so important just for the sake of our health, right? We wouldn't do this with any other part of our body. If something wasn't working, we wouldn't say, oh, well, you don't really need that part anyway, so why do you want it to work? It's like, no, we are a holistic being. So if one part isn't working, that cascades into everything else. So anyhow, I left that doctor's office and I just said, thank you, we're going to move on. And so I ended up going to this pro-life OBGYN clinic that I was told about. And the first thing they had me do is start charting my cycle. So I learned how to chart with the Creighton method. And then from there, they did some blood work, they did an ultrasound, and I was diagnosed with polycystic ovarian syndrome, or PCOS. So yeah, and this is at 18, right? And I got married pretty young too. I got married at 21. Wow. And I went on this journey of healing my body between the ages of 18 and 21. And it took a while. It wasn't a quick fix. But I will tell you, I mean, like I said earlier, I have 3 kids, and we were able to conceive pretty quickly after we got married. And I would not have my 3 kids today if it wouldn't have been for getting off the pill when I did and actually getting the diagnosis when I did as a single person. I now, kind of fast forwarding, I actually worked at that OBGYN clinic for a little while as their on-site Creighton instructor. So I'm a Creighton instructor now. I also teach the symptothermal method. And I'm just so passionate about teaching women about their bodies, because there's so much really basic information that we don't know about. And so when you kind of open the lens to what our bodies can do, what's important that it is doing, like why is it important that we're ovulating regularly? Why is it important that we're doing X, Y, and Z? It's really beautiful when you start to unpack it. And then you kind of get to realize, oh, okay, this is why the pill wasn't fixing the irregular cycles. And then you realize, oh, okay, well, actually charting my cycle can help me understand what's going on, right? So it all kind of goes hand in hand with each other. So that's kind of where my passion comes from. I really love speaking, and I have the podcast and just talking to women about their bodies, helping them to see that the birth control pill is not their best option for their healthcare, and kind of giving them a different option from there.
Thank you so much for sharing your story. And so many similarities, so many parallels with my own. If you're listening and you're not familiar with my story, I disclose it all in episodes 1 and 2, so you can go back and listen, but I'll give a really quick reframer for those who aren't familiar. I had 1 cycle a year, starting at age 16, and my mom brought me to the local OBGYN, and same thing, she diagnosed me with PCOS, and she said that I also needed to gain weight because I was like a lower BMI, was a very high intensity, like 4-sport athlete. So she told me to go and get a hamburger from McDonald's after the appointment. And I know, so like,
yes, because that's the best thing for our health.
Exactly. I'm like, well, if we need to support our nutrient status, a hamburger from McDonald's is not going to help.
Yeah.
And her recommendation was to go on the pill. And thankfully, my mom was like, I don't think that's the answer, to put her on the pill. And to speak to what happens when we suppress ovulation is that it impacts our bone health. And so I already wasn't getting a period except for once a year, so probably ovulating once a year. And stress fractures were my repeated injury in cross country and track. That was my repetitive injury, was stress fractures in my foot, in my shins, in my pelvis. And so the pill would only worsen that. And, this is the kind of information that young women deserve to know, especially our younger athletes, but also all of us as we progress through seasons of life, and that we can hopefully share this with other women so that they're not in the instances that Haley and I were in. So fast forward, I was able to kind of find out it was because I was underfueling and over-exercising as to why I was not getting my cycle. I was able to self-correct that in college. My major was exercise science and nutrition. So I immediately applied the principles I was learning to myself. And then as I went into my doctorate for physical therapy, I was able to further fine-tune things and conceive my first cycle of trying for all 4 of our children. Wow. And so that is wild to think back to 16-year-old me, who was told in that same OBGYN doctor's office that I would probably struggle to have children someday. She wanted to put me on the pill, and she wanted to give me this diagnosis that we later found out I did not even have. And so, today's conversation too, we hope just encourages you to advocate for yourself. And if you're not getting the answers or being listened to the way you feel you deserve at one doctor's office, to not be afraid to seek out other opinions.
Yeah, absolutely. I think that's the hardest part too, is knowing how to advocate for ourselves. And that's something that, because we're not taught about our bodies. I was lucky to know at 18 years old that if I don't have a regular period, that means I'm not regularly ovulating. Like, I think that that's a lucky thing that I learned that young. And that's how I was able to advocate for myself. But there's a lot of women that struggle to advocate for themselves because they know they don't want the pill, but they don't know the language. They don't know the biology to know why. And it just doesn't sit right with them, right? So I think that having that education is so important.
Yeah. And I live in a very rural area, so there is not a lot of options where we are. It's improved, but there's only one OBGYN group that's, in a 30-minute radius. And so, options are more limited. You have to travel further sometimes to get the kind of care that you're seeking. But in the end, it's oftentimes worth that. And so many providers are doing telehealth now where you can do kind of those initial symptom-based conversations first, and then they can order lab work and you go to a lab local to you to get that fulfilled, and then maybe go in person for that consult where they're going to break down the blood work with you and go over things detail by detail.
Yeah, for sure. Telehealth has been such a gift for a lot of people in this area. Yeah.
So to speak to what is happening physiologically whenever we suppress ovulation long term, I mentioned bone health, that stress fractures can sometimes be of occurrence. Also, thyroid health and nutrient depletion occurs, as well as we lose cervical mucus as a health biomarker. Can you speak to what women are missing when they suppress ovulation long term?
Yeah. Well, the first thing that comes, everything that you said, absolutely. But the first thing that comes to my head is just a delayed diagnosis, because, you have the physiological things that are going on. Like you said, you're missing out on cervical mucus, which is hugely important for our cervix health. Actually, speaking of the cervix too, I think there's a study that said for every year a woman is on hormonal birth control, her cervix ages 2 years. And so we know, if you kind of do the math, we know that fertility starts to decline around the age of 32. That's kind of where we're starting to see like a decline when you're not menopausal yet, obviously at 32, but that's kind of where you're starting to see a decline with that. And let's say for a woman who was put on the pill at 16, a lot of women I saw when I was working at the OBGYN clinic, they were on it for years. They were on it 10, 20 years. And so let's say a woman is on the pill from age 16 to 26, and that's 10 years of being on the pill, but now her cervix is aged 20 years. So now her cervix is aged 36 when she's only 26 years old. I hope I'm doing the math correctly there. But so that means that even though at 26 she should be at prime fertility, her cervix is actually starting the fertility of, or like the ability for her cervix to be respondent to estrogen to create that cervical mucus, which is so vital for pregnancy or to be able to conceive. That's now declining. And again, it's not something that we're told or talked about, or even, I don't think a whole lot of doctors really know that, to be quite honest, either. And so yeah, there's a whole lot going on there. But even just going back to the delayed diagnosis, looking at my and your stories, right? If we would have stayed on the pill and just like I was on the pill, if it didn't make me that moody, I would have stayed on it. Like there would have been no reason for me to get off of it. But because it made me so moody, I'm like, I'm not dealing with this. My mom didn't want to deal with it either, quite frankly. So but there's a lot of women that don't have those negative side effects to it. And so they just stay on it. They feel fine. And then they decide, okay, in their mid-20s, maybe they are ready to have a few kids and they want to start trying, and all of a sudden they can't and they don't know why. Well, no woman is healthier getting off the pill than she was getting on the pill. And so the pill will just delay that diagnosis that you really need. So a lot of women like me get on it for irregular cycles, or like you, right? I've heard of a lot of women that get on it because of painful periods. There's a lot of women that just get on it for acne, but there's something deeper there. Like there's a hormonal issue there. There is some sort of physiological issue there that's not being addressed when we put something like a Band-Aid, like hormonal contraceptive on top of that. So I'll give it this. It can be really good at symptom suppression for sure, but it's not actually getting to the root of what is actually happening. And so I look back at my story and I'm like, had I stayed on the pill, I wouldn't have the kids I have today. point blank, because I wasn't ovulating. Or if I was, it wasn't regularly, and it was probably a poor ovulation. And so had I not gone through that journey, I just hands down, we wouldn't have the kids we have today. So I just think, yeah, it delays diagnosis. It affects your fertility, whether that's affecting your cervix or affecting your bone density and long-term health. It also the combination pill, so a pill that's mixed in with synthetic estrogen and progestin. If you look on the World Health Organization, it is on the list of class 1 carcinogens. We know that it causes cancer. And so, and this is free information. Like, you can Google this. So yeah, I don't believe that many women are truly given or are able to give informed consent for this medication when they're on it.
Yeah. And blood clots are another huge one
Yes. Yeah.
And unfortunately, I personally know somebody who passed away from a blood clot due to a birth control pill. And it was a young mother's life lost way too soon. And unfortunately, that happens. And it's not discussed whenever, this is the first child that I have had via home birth. So my fourth baby was born at home with the home birth midwife group, but my other 3 were born in the hospital with midwives who were fantastic in my care. But at that 6-week appointment, every single time it was, okay, what kind of birth control are you going to use? Would you like us to write a prescription for the birth control pill? Or do you want to be placed on an IUD? And every time I said, well, we are planning natural family planning to space our pregnancies. And every time it was kind of written off as not a great option. And so, the risks were not discussed of, an IUD or the birth control pill. But natural family planning, which has 0 risks, was just very discounted. And so let's kind of dive into that now. You mentioned, you don't come off the birth control pill with better health. You're not going to get an IUD removed with better health outcomes. But natural family planning methods, so there are many different methods, Creighton being one of them,
Right,
does give you insights into what's going on with your hormones. And the reason I mentioned this is my first home birth is that this was the first 6-week appointment that it was not brought up of, okay, what are you doing for birth control? And so that was just so refreshing of, okay, we are planning natural family planning methods. They knew that, and they didn't bring up those other options that they knew just didn't align with the approach to more root cause healing that I take as a mother and as a provider.
Yeah. Well, and actually too, I feel like that is the response from most doctors when they say, what kind of birth control do you want to go on? And I will say, though, that there was one doctor that I saw actually who was at the Mayo Clinic. We have a Mayo Clinic out in Phoenix. And I was seeing an OBGYN there just briefly. And I remember telling her, I was very nervous to tell her that I was using natural family planning and not any other form of birth control. And she actually, this is a mainstream doctor, and I was nervous to see what her response would be, but she actually told me, she's like, honestly, I love natural family planning as long as you know how to use it correctly. And I'm like, agreed. We can 100% agree there, because there's a lot of women that are quote unquote self-taught with it, and they read about it or they download an app and then they think they know how to use it. And that's not always the case, or that's usually never the case. You really do need an instructor to kind of walk you through that. But I think what I'm trying to say is that even from mainstream doctors, I have seen both. I have seen where they're like, oh, that's ridiculous, but you do you, I guess, whatever. Versus, even a doctor at the Mayo Clinic was very welcoming to that. So I'm appreciative of that. Then, and also too, I've always been at pro-life doctors. I'm very grateful to have them very close to where I live. And so I've never been asked at the 6-week appointment what birth control I want, but I have been asked when I gave birth to all 3 of my kiddos in the hospital. And I have been asked when I was sitting in the hospital with my brand new, 1 day old, and they come in, they say, okay, what kind of form of birth control do you want? And I just get livid. Because first of all, I'm so hormonal. Second of all, I just did this incredible, crazy, intense thing. And you're asking me, as I'm holding this beautiful, precious little boy, or I have a boy and 2 girls, little baby, what do you want to put in your body to make sure that doesn't happen again? Like, that's the way I hear that question. And it just, oh my gosh, it just rattles me so much. So I just think it's such we need really coming back to, we need to educate women. Like, that is, and educate doctors too, of course. Like, that, it kind of is twofold. But especially for you and I, we need to educate women about how to be able to speak about, or what's the word I'm looking for, advocate for themselves in the doctor's office. I totally lost my train of thought there with what question you asked me. I'm sorry. What was the original question?
That's okay. We were diving into, that 6-week appointment, how natural family planning really is a great option, and how your health actually gets better by charting your cycles versus the other, quote, birth control methods, such as the pill or an IUD, where your health is not at all optimized. If anything, it's suppressed very much so whenever you use those options. And so can you speak to some of the health benefits of charting your cycle, specifically with the Creighton method that women may find when they really dive into their cycle charting?
Yeah, for sure. Well, I do love the Creighton method because it's more of a quote unquote medical method. So it was founded by a doctor named Dr. Hilgers, and he was in med school back in, I don't know, the 60s, 70s. And he actually heard the Pope in the Catholic Church back then was Pope Paul VI. And he heard about this writing, we call it encyclical, written by the Pope. It was called Humanae Vitae, which is Latin for on human life. And in this encyclical, Pope Paul VI was responding to the pressure that the Catholic Church was receiving at the time to change our teaching on birth control, because every other Christian denomination had changed their minds and changed their doctrine, but the Catholic Church hadn't yet. And so Pope Paul VI came out with this encyclical called Humanae Vitae. And first of all, spoiler alert, he does not change the Catholic Church's teaching on this. He stays firm in that we are against birth control for moral reasons, but also because of biological reasons. In this encyclical, he writes that he calls on doctors to start doing more research on women's reproductive health. Because at the time, all we really had was the rhythm method, which is more of a calendar method. You're looking at the calendar. When was my last period? Okay, based on that, if it was February 2nd, then March 2nd is probably around the time it's going to come. And then ovulation somewhere in the middle. But as we know, I really think more and more women who are having irregular cycles, that's not going to work for us. And so what the Pope was calling for at the time was more science-based natural family planning methods. And so Dr. Hilgers, who's the founder of the Creighton method, he responded to this and he founded the Creighton method. Now, back then we also had what was called the Billings method, which is still around. And it was we'd call it an ovulation method. So it's only looking at cervical mucus as a biomarker or a sign that you're looking at to help you understand your fertility. So basically Dr. Hilgers took the information and the research from the Billings method and continued it further. And that's where the Creighton method came along. And so hand in hand with the Creighton method is what we'd call NAPRO technology. So this is kind of where the Creighton method is just the charting portion of it, learning how to chart your cycle. We're only looking at cervical mucus with this specific method. And so you're just observing it. Every time you go to the bathroom, you're looking at your mucus, you're charting what the most fertile thing is you saw that day. And then from there, if you are seeing signs on your chart, which I'll get into, of maybe some sort of hormonal imbalance or something that's off or a red flag, then you can find a doctor that's trained in NAPRO technology or natural procreative technology who can read that chart and from there use it as a diagnostic tool. So when we're looking at a chart, so what I am trained to do as an instructor or as a practitioner is what they'd call it, is I teach you how to chart your cycle. I teach you how to observe that mucus. I teach you how just the logistics, right, of charting that. And then based off of your chart, right, we can look at your mucus patterns. We can look at your bleeding patterns. We can look at when you're dry versus when you're having mucus. And those different things, depending on the timing of your cycle, they really give us a window into what hormonally is going on, because your mucus is a direct reflection of your hormones, specifically estrogen and progesterone. These two hormones kind of ebb and flow throughout the cycle. And so with estrogen, if estrogen is dominant, it's going to create or cause the cervix to produce more cervical mucus. Progesterone does the opposite. It actually dries everything up. And there's a very beautiful meaning to that too, in the ebbs and flows of your cycle, and how your hormones are kind of taking turns in being dominant. But based off of those mucus observations, you can see how that's reflecting your hormonal observation, or your hormonal ups and downs and balances. And so just to kind of give you an example, right? One thing that I see is if a woman is having a couple days of spotting before the first day of her true period. So the first day of a true period is going to be the first day of bright red blood flow, right? Like it's actually flowing. Now, some women will have a day, maybe 2 days of spotting before that, and that's pretty typical. But when we're getting into 2 is actually a little bit too much, but especially 3, 4, 5, a week of spotting before that first true day of a period, that can actually be a sign of low progesterone, because progesterone's job is to keep your uterine lining or your endometrium intact. It's meant to keep it strong. And so if progesterone's falling too soon, it can soften that uterine lining. And the uterine lining is blood cells and tissue, and that's the bleeding that you see. That's what's being sloughed off when you're having your period. So if progesterone isn't doing its job, if it's not high enough to keep that uterine lining intact, it can actually start to more or less spill some of that uterine lining too early. And that will cause you to see some spotting, right? So these are just some things that we can see on a chart to help us understand what's going on with your hormones. And this is why it can be used as a diagnostic tool. So I will say, right, with natural family planning in any method, it's completely medically safe because it's not altering your hormones in any way. It's all observation. It's all a tool, right? And it's a tool for either to be used for family planning, absolutely. But then it can also be that diagnostic tool if there is something more going on. So that's really why I love it so much. And when I was working in the OBGYN clinic, as the on-site Creighton instructor, right, I was seeing women who were there because they were struggling with some sort of reproductive issue. Oftentimes it was infertility. And here's another example, right? Actually, a lot of times when I was seeing couples that were struggling with infertility, I would see I taught them how to chart, and I would look at their chart, and they were not producing enough cervical mucus, like 9 times out of 10. That may not be the only reason for struggling with infertility, but that's a huge portion of it, because if you're not producing enough mucus, sperm loves cervical mucus. They love it so much because it contains sugars that they feed off of. They can live within cervical mucus within your body for up to 5 days. It causes the vagina to be a very basic or alkaline environment. Without cervical mucus, it's a very acidic environment, and sperm just can't live in that for very long. But when there's mucus there, it preserves the life of that sperm. And so for women or for couples that were struggling with infertility, a lot of times I would see that they just weren't producing enough, or if any, cervical mucus that was actually preserving the life of that sperm long enough to then meet the egg to result in conception. So yeah, there's a lot of things there that we can look just based off of a chart alone to help us understand what's going on with your hormones. But then I'm also thinking too, you gave the example of when a woman, has a baby, she goes back to that six week doctor appointment, and let's say she does want to use natural family planning. It's going to look a little different at that point than it would normally when you're normally cycling, yes, obviously. But it's not impossible. It just looks a little bit different.
Let's dive into that. That was actually going to be my next question. So this is perfect. How do we have to shift cycle charting in the postpartum season?
Yeah, that's a really good question. And to be quite honest, that can be a very frustrating place for a lot of women because things don't look the way that they used to look. Because for most women, it takes a couple months, if not, it also depends on how much you're nursing. But the hormone prolactin that's producing breast milk actually is naturally suppressing ovulation. So there are women that get their cycle back at 6 weeks, and that just is what it is, and nothing that they do changes that. There are other women that don't get their cycle back until they are completely done nursing. I have seen it go both ways. And so with that, when you're kind of looking for signs of ovulation when you're charting, 1/3 of women are going to ovulate before they have their first period after they have baby. So the purpose of even looking for mucus or charting with natural family planning when you're in that postpartum phase is because you're looking for signs of ovulation, because you might not have your period be like, hey, by the way, I'm here, your fertility is back. That might not come first. It might actually be ovulation that comes first. And for many women, right, when we have a little baby, we're not always ready to jump right back into things either, and that's okay. And so being able to kind of postpone another pregnancy until, you and your husband feel ready and whatnot, NFP is a really good option. Now, I will say though, because things kind of get wonky, some women are producing mucus all the time and they're like, am I fertile all the time? And no, you're not. And so that's why what I'm getting into is it's really important to be working with an instructor in whatever method that you're choosing to use during that time. I mean, in any time, when you first learning from an instructor, I'm super, super passionate about making sure women are not necessarily thinking they know how to do it just based off of the app that they downloaded. It's really important that you're working with an instructor to kind of guide you along that first learning curve. But then let's say you've learned it, you're proficient at it, you get pregnant, that's great. You go the 9 months, you have baby, and then you start charting again and things are looking a lot different than they used to. Go reach out to your instructor again, or if she's not teaching anymore, find another one, because it is really important that you have somebody walking you through that time, because things look so different. And again, for some women, they get their cycle back right away. Other women, it takes months. Other women, it takes years. And so you're just kind of looking for those signs of ovulation when it comes, so that you can plan your family accordingly.
Yes. And to speak to that, yes, we ovulate before we have the shedding of the layers, before the bleeding. And so you absolutely can conceive or get pregnant before you have your first period. My best friend, actually, that just happened to her. And she was like, what? How? Because they'll have two babies very close together again. Yeah. But it happens. And so can you speak to some of those signs that your fertility is returning from the cervical mucus standpoint, and any other signs that a woman might notice when she is postpartum, she is nursing, and she's watching out for signs of fertility?
Yeah. So there's kind of two scenarios that I'm thinking of right now. So the first one is where a woman is just pretty much dry. She's not really producing mucus at all during her postpartum season. And in that case, you're observing for mucus as you normally would. So anytime you go to the bathroom, you're wiping, you're looking to see if there's any mucus on the toilet paper. And so anytime you see any type of mucus for a woman who's really just remaining dry, anytime you see mucus, you're just going to consider that fertile, because mucus, it could be in that case a sign of a return to fertility. Now, the other case that I'm thinking of, which makes it a little bit more difficult, is for women who have mucus all the time. And I'll raise my hand because I am one of them, and which makes me, I actually feel like I'm very confident in helping women when they have mucus all the time, simply because I've had to figure it out for myself too. So I have that personal trial. But we're looking at that point for what is different. Is there anything different about the mucus you're producing? So some women, it's just kind of like same old stuff every single day. They're always seeing something that like only stretches a tiny bit. Maybe it's kind of cloudy looking or white. And that's just what they're seeing all day, every day. And they're just not seeing anything different. Well, that's probably just your baseline. That is your baseline. We're not going to consider, and I say this not to allow your listeners to diagnose themselves necessarily and do this for themselves, because it's important that you're working with an instructor. But in general terms, if you're just seeing the same old stuff all the time, that's a good indication that that's not actually mucus that's pointing toward fertility. That's kind of just saying that your ovaries are still kind of quiet. Estrogen is not rising yet. You're just that's your baseline. Once you start to see something different, so maybe you're seeing the same old stuff, and then one day you look and you're like, oh, whoa, that's a lot stretchier than I remember it being, or, oh, that's clear. That I haven't seen something like that in a while. That's where you put the flag up and you're like, okay, this is something different, right? And that's a sign of estrogen rising. And as estrogen rises, that could actually be indicating that return to fertility. So that's what I help women do, especially when they are seeing mucus all the time, is we're looking at, how is it just essentially pretty much the same all day, every day? Or when are you seeing those changes? And how can we apply the instructions for if you're wanting to avoid pregnancy, right? How can we apply those instructions to the observations that you're seeing? Now, I will say too, for other methods, right? I'm also a symptothermal instructor. I have a huge love for taking your temperature. I think it is so helpful, especially for women who have irregular cycles, because a lot of times when a woman has irregular cycles, I'm kind of speaking from personal experience here, you're kind of having mucus kind of come up and come down all the time, and you're wondering, is this ovulation? Is this ovulation? You're not quite sure. But when you're taking your temperature, what's happening is you're waiting for your progesterone to rise. So once you ovulate, progesterone's pretty like null and void up until ovulation. But once you ovulate, that triggers progesterone to start rising, and then it should rise and stay high for about the next 2 weeks until your next period. And so progesterone is a thermogenic hormone. So it causes your body temperature to rise. So that's why we can be looking at our body temperature to help us understand where our progesterone is at. And so why I love it for women with irregular cycles is they might not see a temperature rise all that often, but when they do, it's a really helpful kind of cross-check tool to see, okay, when I saw that mucus observation, that actually did indicate ovulation, ovulation. I'm getting my words all mixed up. Sorry. That does indicate ovulation because your body temperature is rising right after that, which indicates progesterone is starting to rise. Progesterone only rises after ovulation. Anyhow, so I think that it's also a really helpful tool. Now, when you're nursing, it can be tough because you could be waiting months and months and months taking your temperature every single day and not seeing a temperature rise. And it's because you're not ovulating yet, right? Especially when you're nursing a baby, that's suppressing your ovulation in a very natural way. And so we might not see that temperature rise. So some women forego the temperature check at that point because it's like, I don't really want to be doing this for months and months and months and months and months, seeing the same old thing all day. But some women, they do that because they want to make sure that they don't miss when their next period might be coming if they miss that temperature rise. So that's just another example. But yeah, I also know women who love the Marquette method, which involves like strips that you would pee on to help you understand where your estrogen and LH levels are at. And a lot of women postpartum really love that too. So there's really no one method that's best. It's really the one that you love best, the one that you are going to use. But it can be a very helpful tool in that season, especially.
Absolutely. And this is why I'm a huge advocate for starting preconception. I started well before I was even engaged. I wasn't even with my current husband whenever I started cycle charting, just to understand my body. And I wasn't sexually active, So I think there's this misnomer that you have to be trying to conceive or sexually active for a need to chart your cycle. And it's like, no. Like, this is the fifth vital sign for women. And honestly, I would love to someday be teaching high school students about their bodies in this capacity from a very age-appropriate lens, because it gives you so much feedback and understanding of, oh gosh, that's why I'm getting stress fractures, because I'm not ovulating regularly, and I should be. And it just could prevent injuries in high school athletes, but also give this literacy and this understanding about our bodies to teenage girls and to young women, so that when it does become time to try to conceive with their spouse, they know their fertile window. They know what that cervical mucus means. They know it's not an infection. It's a sign that their body is fertile. And then when it becomes time for postpartum, they know their body well enough to start to understand those subtle shifts, because everything you described, I've done it, so I know exactly what you're talking about. But to somebody who hasn't, it seems very like, what? How am I going to notice those little shifts? And they are minute changes. So the more practice you have, the easier it is in the sleep-deprived state of postpartum to track those minute changes and know what it means for your individual body.
Yeah. And I will say, if you're there, you're there, and you're putting the work into it then. But I will say postpartum is a really hard time to learn NFP for the first time. Mm-hmm. So in a perfect world, again, if you're there, that's where you're at. It's not impossible, but it's a lot easier to learn how to chart your cycle when you're early in marriage, when you're engaged, when you're single. I mean, that's when you have the time to be able to put into this. And I am starting to go into the high schools and colleges to teach this. And it's just been such a gift because this is the information that I needed and that
Right.
I just, by the grace of God, received when I was 18. Not many girls are told that. And so they are and girls are put on the pill as early as when they start their first period. I mean, it can be 12, 13, 14 years old now. And yeah, it's just, again, I always just kind of go back to this lack of education that we're given as women and I think that really is because of this culture of birth control, how it's a lot easier. I'll give it that. It's a lot easier to just take a pill every day. Or actually, when that's too difficult, then you can get an IUD or you can get a shot or you can get an implant because then you can just forget about it. And that's said in the name of convenience. But in all reality, it's so detrimental to our health. And we're not learning anything more or anything at all about our bodies when that happens. And so are we actually able to give informed consent for those medications? So I think it is really important that this education goes all the way down to high school. And even still, I think too, again, we're talking in a perfect world, but when a girl is young, like age 9, 10, 11, of course, age appropriate information, but having that conversation with their mom, having their mom sit them down and talking to them about what their first period is going to look like, talking to them about what all is going on with this whole ovulation thing, right? And having that explained to them at an early age, it can do no harm. I think it can really, really be beneficial to help our daughters even understand about what the female body does. And actually, my oldest daughter is 4 and she is very curious and I can never go to the bathroom alone, as you probably know all too well. And there was one time I was in the bathroom and I was on my period and she came running in and here we are and we're in this moment and she's like looking down, looking at me. And I'm like, okay, how do I respond in this moment? Mm-hmm. I just remember telling her, I'm like, okay, you know what? When this is nothing to be concerned about, when an adult woman, every once in a while, she'll bleed just a little bit and it's not painful. And I say that specifically because if it is painful, that's a sign something's wrong. Right. So I tell her, it's not painful. It doesn't hurt, mommy. It's just totally natural. And this is how God made my body. And she looked at me and she's just like, okay. And then ran off. And I'm like, okay. We made it through that one. Yeah. But especially just imparting that information. Would I have explained that to her at that age had that not happened? No, probably not. Mm-hmm. But because we were given an organic ability to have that conversation, there we had it. But getting that information when we're young really just, I think it gives us this lens into a culture, a pro-life culture, a culture of understanding our bodies as good, and that periods aren't necessarily just this huge burden that women have to suppress, but it's actually a sign of health. It's a sign of that our bodies are working the way that God intended them to. And so, yeah, I mean, of course, age appropriate depending on where the girl is, but having this information young is so, so important so that they can be an advocate for themselves later on.
Yeah, my oldest is my only daughter and she's 6. And yeah, I have had multiple instances similar as that. And you give them just like a little bite-sized amount, just like you did. And they're like, okay. And then the next time it comes up, and they might ask a different question. You get kind of another little layer. Where it came up most recently for me is that she wanted to be there immediately after our baby was born at home. So she was there less than 2 hours after his birth. And so she had questions, well, mommy, why do you have to sit on that protectant thing over the couch? Like, why are you bleeding? Oh, honey, well, because my body's healing. I just had a baby. I'm not in pain. It doesn't hurt. But sometimes your body bleeds when it's healing. And that's what happens after you have a baby. And she was like, oh, okay. And it doesn't hurt? I'm like, no, it doesn't hurt. My body's just healing. Just kind of like if you have a scab and it doesn't hurt anymore because you already fell and now it doesn't really hurt, but it's still bleeding if you move too much and crack it back open, that kind of thing. And she's like, oh, okay. But I love your point of, and it doesn't hurt, because
Yeah.
as a physical therapist who knows a lot about pain psychology, chronic pain comes from when the nervous system is overstimulated. So when we have chronic pain patients, a lot of times there is no physical trigger to why that person might be in pain. And we can see this in pelvic pain, we can see it in back pain. They might have an MRI, they might have an ultrasound, and everything looks good. I don't know why you're in pain. And it's because the body is sending signals to the brain that there is an injury, that they are in active pain. And sometimes that can be happening from those muscles being overly tightened. And it might be from a past injury. So let's say somebody had, God forbid, but maybe they had sexual trauma when they were younger, or maybe they had a back injury from a sport at one point in their life. And those muscles, whether in the pelvic floor or the back or anywhere in the body, are overactive. They put pressure on the nerve, which then signals to the brain something is wrong. And then that signal can turn into pain. So that signal could be read in somebody who is not overstimulated as, oh, my back's tight, or oh, my pelvic floor is tight. But for somebody else, it could read as pain. And so talking from a young age about, oh, it's not painful, it's just the body doing what it is designed to do. Oh, it's just the body healing. Then we don't over tighten. Then we don't respond in fear to that symptom. It's just met with curiosity instead. And, oh, this is another symptom. This is something else my body is telling me. What can I do with that information? Oh, I can rest. I can rest, for instance, in the postpartum season to allow that bleeding to stop, my body to heal, and then I can go back to more of my regular activity or lifestyle. In the instance of a period, oh, that might happen for 5 to 7 days, and then it's done and it's healed up, and I go on. But if it is painful, that's our body telling us something, and something we need to dive deeper into.
Yeah. Oh, for sure. I think too, I love that you can bring in that lens as a physical therapist as well. And that I'm glad you said that, because that even confirmed, like, okay, yes, I am doing it right.
Yeah.
As especially too, I mean, as young mothers as well, where we're just kind of like figuring it out as we go, and just when those questions arise that we haven't necessarily been able to prepare well for, that we say what we think is best at the time, and then maybe learn differently later on. But I do think that just being, especially in the lens of our cycles, recognizing like, this is natural, this is normal, no, it should not be painful, this is how God created the body, and this is good. And being able to grow up even in that lens is a total game changer. And so I think, but of course, not all of us have that experience. And so we learn it when we're 18, or we learn it when we're married and going down that path. But it's never too late to learn this either. But we can definitely do better for our own daughters, I think, and sons too, and sons. Yeah. I will say I have a 6-year-old son, and he knows that what I do for work is I teach NFP. He doesn't know what NFP is. He knows that there's 3 letters that he learned in kindergarten. But basically what I've explained is like, mommy teaches people about how God created their body. And that's what NFP is. And so I remember there was one time I was teaching my sister NFP, and I was leaving one evening to go and to her house to go teach her, and he was like, "Mom, where are you going?" I'm like, "Oh, I'm going to go teach Auntie NFP." And he goes, "Auntie doesn't already know NFP." I'm like, yes, okay, because in your little bubble world, everybody knows what NFP is, and that's a great thing. So even for our sons too, like, we can still be prepping them to not feel like, oh, this is a gross thing that goes on for women, and it's just kind of their deal, and they have to deal with that. It's like, no, that you can have awe and wonder for the female, for the woman that's next to you, by understanding how God created them. So.
And to even be aware that it's an option, because he's probably not going to those, yearly gynecological appointments, with his fiance or whatever it might be, his girlfriend, in those earlier seasons. And so to already have the awareness and the capacity to bring up that conversation when you're discerning if somebody's the right partner for life for you is a very important lens to be able to come from, because it really does set up your relationship for understanding God's design for creating new life, when that fertile window is, and then how to either try to conceive during that window or to delay if you're not quite ready to have children yet. And so it's just such a beautiful lens into how we were created both as male and female, and a joining together and seeing how that unfolds is really special.
Yeah, absolutely.
Well, Haley, I have one final question for you
Yeah,
today, before we close up. It's been an amazing almost hour of conversation
I
here.
know. This has been great.
If somebody's cycle is quote normal and they still feel off, where would you point that person? Because on paper, everything looks textbook, but they still don't feel quite right. What would you say?
Yeah. That's a really good point because that is I've seen that case too. Trust your gut. I think that we as women, we have an intuition that's naturally built into us. And I think sometimes we forget that or we downplay that when if you're not feeling right, but everything on paper looks fine, that still probably means that something isn't right. And that would be reason to go see a doctor. So for anyone, whether it's somebody who has wonky cycles or someone who has completely textbook cycles, but just feels off, see a doctor that is trained in restorative reproductive medicine. So this is kind of where, with this education part of teaching women, I don't want you to be on birth control pill for XYZ reasons. It's like, okay, well, what's the other option then? Because some women are like bent over in pain on their period and they shouldn't live like that. And maybe the pill has helped them with that pain. Or as you're saying, maybe women don't have any reason to believe based on their chart alone that something's wrong and they get their period like clockwork, but they just feel off, right? If they go to a regular doctor and present with that, they're going to be put on the pill. I mean, that is what we have in mainstream medicine right now. That is the go-to. So finding a doctor that's trained in restorative reproductive medicine is vital. That's a very important thing. I think honestly for all women that are interested in a very restorative health approach, which I think should be what all women should be interested in. Finding a doctor trained in that. So there, as we talked about earlier, telehealth options are getting a lot more popular now, which is such a huge blessing. Going to find one, I would recommend going to different websites like naturalwomanhood.org is a great place to go, even just to learn more about these topics. But I do believe they have a directory of doctors on their website. Factsaboutfertility.org is another great place to go. That organization is actually there to teach doctors about how to practice medicine in this way. So they have a good directory there. Fertilitycare.org is the Creighton form of that, and they also have a directory. So I think starting with those platforms, if you have any other websites that you can think of that have those directories, but finding a good doctor that's trained to look at your chart, to use it as that diagnostic tool, and to actually heal you from the ground up there. And especially too, I mean, it's one diagnostic tool. So when a doctor is looking at you, maybe the chart isn't showing anything different, but maybe your blood work is, or an ultrasound is. A lot of women, and this isn't to impart any fear, but just to give an example, endometriosis. I've seen a lot of women who ended up having endometriosis, but their charts look totally normal. And it's because it's not often a hormonal issue. It's more of a physiological issue at that point. And so so there's many different things that it could be. And I myself, as not a doctor, should probably stop there. But yeah, don't discount yourself if you feel like, oh, there's nothing wrong on paper here, so I should just deal with what I'm dealing with. No. Like go seek out information and trust your gut with that. Trust your intuition.
Yeah. And the other thing I'll bring up with that would be pelvic floor physical therapy, because things can look fine on paper, but then they get referred to us because the doctor's like, I don't know why they're in pain. Like medically, everything looks fine. But then we do our evaluation and they are so upregulated in their nervous system, that those muscles are so tight, both in the pelvic floor and the diaphragm. We might find that the rib cage is flared. And so all those internal reproductive organs are not quite sitting internally how we would optimally want them to for ideal blood flow. And so when we restore postural alignment to the rib cage and to the pelvis, now everything in the middle kind of settles back into space better. We'll also feel the abdomen for trigger points, and we can find those areas of increased tension, whether it's muscles, fascia, or kind of those visceral organs. Do manual therapy, reduce those restrictions. Now the blood can flow easier to those organs, but those aren't things that are going to show up on an ultrasound.
Right. Or even a chart.
Yeah,
it might not show up on your chart. Yeah. Yeah.
They're going to look fine that way. And so, we can give breathwork exercises, we can do manual therapy, and really address like the nervous system, the muscles, the fascia, that component. And the other thing I'll mention with that is constipation. We will oftentimes see where women are like, yeah, I'm quote regular. And to them, they think having a bowel movement every 2 days is regular. Whereas really having a bowel movement 1 to 3 times per day is ideal. But that's something that a traditional medical doctor is going to be like, oh yeah, you're fine, you're regular for you. Or they're not just going to even dive deeper because that's not quite their wheelhouse. And so that's something else we'll look at, because if you are backed up, you are constipated, that's also going to shift things around internally. You're also reabsorbing some of those toxins that are sitting in your colon, which can affect the way your nervous system is going to perceive pain. It can affect fertility, all of that. So those are just some other things that we'll look at in a pelvic floor physical therapy evaluation. My team does do those in person in Ohio. We're in Sydney, Ohio, but then virtually we'll do consults nationwide, worldwide, where we can do just kind of a big picture consult with you and help maybe point you in the right direction with more of a coaching lens in that virtual realm.
Yeah, that's so helpful. I myself have done pelvic floor physical therapy for like postpartum stuff, and oh my word, I have one in my back pocket, and I'm like, I'm always gonna go to this girl because it is such a game changer for sure for a lot of women's issues. So yeah, it's great.
Well, Haley, for those listening today, if they would like to work with you for the Creighton method, can you talk about how you work with women and where they can find you?
Yeah. So I've recently founded what I'd call the Truth and Fertility Project. So it kind of has 3 pillars to it. So the first one is the podcast. So you can find the podcast Truth and Fertility. That's going to be on Apple, Spotify. I also just started posting on YouTube as well, which I'm excited about. And then with that also is an Instagram, which I did just start as well. So at Truth and Fertility. And then the kind of second pillar to that is teaching the Creighton model. So I teach completely virtually. And so I host an intro session once a month. That's where you'd get started. And it's an 1.5-hour presentation where I'm just kind of walking you through biology, hormones, how to chart, all of the good things. And then from there, it's just one-on-one follow-ups from that to make sure that you're charting proficiently. So that's kind of the second pillar. And then the third pillar is speaking. So I do speak nationally on specifically to high school, college students, and young adult women on this topic because of just how much I've said I'm passionate about making sure that these women are being, all women are being educated properly to be able to make the best decision that they can when they're in the doctor's office. So all that information is also on my website, which is truthandfertility.com. And yeah, I believe that's it.
Amazing. Well, thank you for joining us today, Haley. And if you want more information, check the show notes. I will put everything there.
Thanks for having me.
Yeah, as always, take care and be well.